With Dr. Chibanzi Mwachonda, who is the Acting Secretary General of the KMPDU, and now we are being joined by Dr. Asha Mohammed, who is the Secretary General of the Kenyan Red Cross. Good morning, Dr. and thank you for joining us this morning. And let's begin. We know that the Kenyan Red Cross has been having operations to train or rather to counsel health workers that are involved in this particular pandemic. What exactly have you been doing with these officers, and what would you say is their state of mind and preparedness in dealing with these affairs psychologically?
Yes, good morning, and thank you for having me in this show. Yes, Kenya Red Cross has been involved in providing psychosocial support and counseling, targeting, yes, healthcare workers, but also other responders, because when we talk about caregivers, it also includes other cadres, be it ambulance providers, community health volunteers, first responders like ourselves in the Red Cross, who continue to interface with communities and also with people affected. Mm-hmm. So yes, we have had various activities that have taken place. One is actually training of a number of counselors as well to be able to carry this service, because you can imagine, yes, we have counselors, but it's important that they also have the correct information and facts about COVID-19 for them to be able then to support better. We've had some virtual sessions with some healthcare workers in Bagazi and Kenyatta National Hospital, and this continues, and we hope to expand this to include other counties as well. But we also have a hotline, 1199, which is being used for telecounseling, and any Kenyan can call in and be able to get support, and also referral to other government agencies and partners who can give further support.
And so specifically, have you been in touch with the officers that are at the front line dealing with patients that are affected by this disease?
Yes, we have a number of people who are actually in the front line, and we have been able to support them. And like I said, ranging from all these different cadres, those working directly in the hospital, those doing screening at the entrances, those in the communities, those in homes, because let's also remember that people at home, family members, are also frontliners, because they are the ones actually who come into contact with people affected first, even before they are taken to the health facilities.
Okay, and Dr. So when you speak to them, how is that gap? And especially I'm talking about those people that are the front line. How disturbed are they? I know the cases are still few, and the disease is still young in the country compared to other countries in Europe. How disturbed are they, or how do you rate their state of mind currently?
Well, there is, of course, a lot of fear and anxiety, and as you can imagine, it's there for even healthcare workers more than maybe the rest of us. But yes, there's that anxiety. But I can say that I think healthcare workers have gone out of their way to really put themselves to the service of Kenyans, and I want to actually appreciate that very much. That despite the anxiety, despite the fears, they haven't downed their tools, and they're out there looking out for each other.
Right. So
this is actually something that we all need to be able to support them in.
All right, and we're still with Dr. Chibanzi Mwachonda here. And Dr. yes, we hear the efforts that the Kenya Red Cross is putting in place, but for you, how important is this, even as you continue with attending to the patients that are affected, but also preparing for what may befall the country, as predicted by CS Mutahi? How important is your mental stability and the efforts that you'd receive from institutions like the Kenya Red Cross?
So we first is to thank the Kenya Red Cross for the efforts that they've taken in ensuring that they do take care of all caregivers who are responding to this. And so for us, it's important, because it's the bedrock, the foundation under which all caregivers, from doctors to nurses, clinical officers, to the responders, to the drivers, the support staff, it is the mental health that really matters. So that is a key ingredient in all this war. Right. Because if the mental status is affected to an extent where there's a lot of anxiety, there's apprehension, we will not have health workers working the way they should. So it's a very key thing for us. And in fact, going forward, we have actually proposed that we hire as many psychosocial support staff for the caregivers. And not just for the caregivers, to the society, even to the families that are affected, if possible. And this is a time that we are supposed to all collaborate in this pandemic and in this situation. And then another thing that I say mentally also is important, and I'd like to put this across, and I appeal to the National Police Service and the Ministry of Interior. We've received cases of health workers out there going out after the curfew period, and they're supposed to be part of the essential services, but they have been affected. We've had some who've been assaulted by the police, and this affects the mental status of the other workers, because when people are apprehensive about not being able to perform their duties, then we are moving in the right direction.
All right, Daktari. And so, Dr. Asha Mohammed, so yes, you take care of the health workers, but when it comes to a patient that has been infected by the disease or affected by the disease, of course, some of them, especially when they are yet to identify that they have tested positive, or when they are yet to test positive, they have the mental disturbance that they have to self-quarantine. How are you taking care of the patients as well as the family that is next to these patients that once testing positive, they are supposed now to self-quarantine?
Yes, I think as I mentioned, we have extended this service. For example, for the travelers who came into the country and now on mandatory quarantine, we have counselors actually attached to the quarantine centers where they are able to actually support those who are also in quarantine. So in the same way, we extend that also to families, because we get calls as well from family members who are anxious about their relatives who are also in quarantine. So yes, the same service is extended even to those in quarantine here.
Right, and of course, you know the stigma that is coming with this disease. We have heard of cases like in Kwale of a man that was allegedly killed because people thought that he had the coronavirus. There are also people who are very much afraid, and understandably so. How do you then move on? Because there are people that may not be in a position to reach you, or you yourselves are not able to reach them. How are you approaching this question of ensuring there's mental stability across the country, especially for those hotspot areas?
Yeah. So through our network of staff and volunteers around the country, we are present in all the 47 counties. We have volunteers as well who have been trained to be able to give psychosocial support. So even as they go out to sensitize and give information about COVID-19, they are also in a position at least to offer psychosocial first aid to the members of the public. And you're actually right, the question of stigma, this is even not just for those directly affected, but also for healthcare providers. We have even as first responders cases where sometimes members of the public would say, don't come too close to us because we know you're dealing with this issue. And so the stigma is real. And I think we all need to really do what we can to ensure that we deal with this, because it will also come in the way of us actually responding and making a difference in this pandemic.
All right, and finally, Dr. Mwachonda, so yes, like I said earlier on, the disease is still young, but in the coming days or weeks, we might have the numbers going up. When you look at the staff that we have, the medical and health workers that we have already dealing with this situation, for how long do you think they can sustainably do so without, burning out like you've seen in some of the countries?
Well, the issue of burnout is really going to be dependent on the extent to which we'll get in terms of the cases that we'll have total in number and how long it will take us to combat the disease. So the best that we can do is to put in measures that will ensure that we reduce the burnout of the caregivers. One way is to ensure that we already are supposed to have COVID teams for the health workers, because remember, even as we are having coronavirus, we do have other diseases that are still presenting to the facilities. So first is to have teams, ensuring that we have teams that are specifically for coronavirus, the COVID-19 patients.
Right.
And those teams will then have to work with others. So we might have to get to a point where we keep shifting. Once we've the workers who are seeing COVID-19 patients have been declared safe and free from the disease because they're in contact with the patients, then they can be given a break from this. But this can only happen if we do not have an overwhelming number of cases, and where now every single doctor available, nurse will be dealing with COVID patients. Okay. But shorter working hours, facilities of rest, psychosocial debrief sessions for the workers, those are the measures that will help in ensuring that we do have a decrease in the burnout.
All right. And finally, Dr. Asha Mohammed, so what is your estimation in terms of how sustainable these efforts are to ensure that we do not reach that crisis moment, especially for the stability of health workers and caregivers?
I think, as Daktari has mentioned, it's really about taking care of the healthcare workers, managing their time in dealing with this. I know there is an effort now through the ministry and also the Kenya Medical Association to ask other healthcare workers to come on board, because yes, we need an army of people that can be able to support each other, because those who are already working need a break. They also need some time to reflect, and so it's important that we rally around the country, as many of us as possible, to be able to take part in this response.
All right. Dr. Asha Mohammed, the Secretary General of the Kenya Red Cross, thank you so much for making time for us, as well as Dr. Chibanzi Mwachonda, the Acting Secretary General, the KMPDU. Thank you so much for making time for us this morning to talk about that very important conversation about health workers. Now,